Here we will draw the key histologic features of cartilage and its forms of growth. To begin, start a table. Denote that cartilage is connective tissue with a semi-solid extracellular matrix that comprises collagen fibers and ground substance, which provides both support and protection for other body tissues. We will discuss similarities and differences between the three cartilage types: hyaline, elastic, and fibrous. First, we'll draw hyaline cartilage, which is the most abundant type of cartilage in the body. To begin, draw the following hyaline cartilage layers: the matrix, which appears glass-like under the microscope. Then draw the perichondrium layer. Indicate that the matrix comprises type 2 collagen fibers, which are invisible in standard histologic preparations. Next, within the matrix, draw a few lacunae. Inside of them, draw chondrocytes, which are mature cartilage cells that generate and maintain the matrix. Next, label the cluster of chondrocytes as an isogenous group. Denote the following: hyaline cartilage forms most of the fetal skeleton and is important in endochondral bone growth until the end of adolescence. In the adult, it persists in the nose, trachea, and larynx, thorax, and also covers the articular surfaces of long bones where it has no perichondrium. Degeneration and calcification of hyaline cartilage may either be physiologic or pathologic. It is physiologic in the case of endochondral bone formation, but it is pathologic in the case of osteoarthritis, which leads to pain and restricted joint movement. Calcification, the processes by which cartilage is replaced by osseous tissue, is common in hyaline cartilage, but very rare in elastic or fibrous cartilages. Next, draw elastic cartilage, also known as yellow fibrocartilage, which shares many similarities to hyaline cartilage. For instance, it also contains invisible type 2 collagen fibers within the matrix. But denote that a helpful distinguishing feature of elastic cartilage are its interwoven elastic fibers. To illustrate these fibers, draw the matrix, a lacuna, and a chondrocyte. Then draw the elastic fibers themselves as squiggly fibers of elastic proteins, which provide flexibility. Draw the perichondrium overlying the cartilage. Denote that elastic cartilage provides flexibility and resistance to permanent deformation. Bend and release your ear. Feel it pop back into place. Elastic cartilage provides this resistance to deformation. Denote that elastic cartilage is present in the external ear, the auditory or eustachian tube, and the epiglottis. Next, draw fibrous cartilage, which also shares many similarities with hyaline cartilage, but denote that two helpful distinguishing features are its lack of perichondrium and its rows of chondrocytes that have type 1 and type 2 fibers between them. The bundles of type 1 and type 2 collagen fibers provide strength and durability for shock absorption. The matrix is dense and contains relatively little ground substance. The type of joint and person's age determine the relative proportions of these two collagen fiber types within the fibrous cartilage. Fibrous cartilage is found most notably in intervertebral discs, pubic symphysis, menisci of the knee, and tendons, where properties of stress resistance are particularly important. This ends our essential material. Now let's return to the hyaline cartilage diagram to draw a few more histological details of cartilage. The matrix, which is basophilic and stains purple on H&E section, contains territorial matrices that comprise the proteoglycan-rich dark staining area around the lacunae. Then indicate interterritorial matrix outside of the isogenic groups. It stains lightly. Denote that the ground substance of the matrix, which is gel-like, comprises the following components: proteoglycan aggregates, which are bound to collagen fibrils and which provide a semi-solid structure to cartilage; chondronectin, which adheres collagen fibers to chondrocytes, intercellular water, which is 60 to 80% of net weight of the cartilage. It varies by location. Now divide the perichondrium into inner and outer layers. Label the inner layer as the chondrogenic, also known as cellular layer. Indicate that it comprises chondrogenic cells. Draw a chondroblast within the matrix and show that chondrogenic cells become chondroblasts. Chondroblasts produce the matrix and collagen fibers and eventually mature into chondrocytes. They comprise a large Golgi apparatus and abundance of rough endoplasmic reticulum, rough ER, lipids, and glycogen. Next, label the outer layer as the fibrous layer. Indicate that it comprises type 1 collagen fibers, blood vessels which supply nutrients to the cartilage below, fibroblasts which are thought to produce collagen fibers and/or chondroblasts. Now let's address the formation and growth of cartilage, which occurs via two separate processes, interstitial and appositional growth. Both types occur simultaneously during early development. The relative rate of each type of growth determines the shape and structure of the cartilage. Begin with interstitial growth, which occurs within cartilage. Let's use a simple hyaline cartilage example of interstitial growth. Draw a matrix, single lacuna, and chondrocyte. For simplicity, omit the perichondrium. Next, draw another matrix and lacuna, but in this lacuna, show two dividing cells. Now show another matrix, but in it, show that each of the dividing cells has developed its own lacuna, and show that the chondrocytes secrete new matrix. Lastly, show a matrix with two lacunae that are further apart to indicate that the daughter chondrocytes move away from each other in their lacunae as they secrete new matrix. Interstitial growth occurs during early stages of cartilage formation and in the growth plates and articular cartilages of growing long bones. Now let's show appositional growth in which new matrix forms at the periphery of the cartilage. Again, let's use a simple hyaline example. Draw the following layers from superior to inferior. Perichondrium layer, which divides into both fibrous and chondrogenic layers. New matrix layer, which is created via appositional growth to expand cartilage. Older matrix layer. Now within the chondrogenic layer of the perichondrium, draw the flat chondrogenic cells. These cells will differentiate to become chondroblasts. Within the new matrix, draw a chondroblast. Indicate that it secretes the new matrix. Inferior to the chondroblast, draw a chondrocyte and its lacuna within the new matrix. When chondroblasts are surrounded by matrix, they become chondrocytes. Within the older matrix, draw a lacuna and mature chondrocyte, which remains active and maintains the matrix. Hyaline cartilage that has been only nominally damaged can slowly repair itself via appositional growth, but severely damaged cartilage is often replaced by tougher, more fibrous connective tissue. Lastly, let's address specific hormones that impact the growth of hyaline cartilage. Denote that the following hormonal substances stimulate histogenesis: thyroxine, testosterone, and somatotropin. Denote that the following hormonal substances inhibit cartilage histogenesis: cortisone, hydrocortisone, and estradiol. For reference, consider how the following nutritional states affect bone growth. Hypovitaminosis A diminishes the thickness of the epiphyseal plates, decreases the growth rate. Hypervitaminosis A accelerates ossification of the epiphyseal plates, induces short stature. Hypovitaminosis C inhibits matrix production and distorts cartilage columns and epiphyseal plates. In this instance, bones are weak and scurvy can develop. Hypovitaminosis D inhibits calcification of matrix, causing softening of the bones, osteomalacia. In children, growing bones become bowed, called rickets. This concludes our diagram.